Welcome, everybody. Thank you for joining us this evening. This is our mental health crisis conversation with Dr. Jenny O'Donnell and Dr. Priya Sehgal. My name is Pavan Parikh. I am the Democratic nominee for Hamilton County Probate Court judge. And one of the many different jurisdictions and authorities under the probate court actually deals significantly with mental health. And I'm running to be the next Hamilton County Probate Court judge because I believe I have the diversity of life and legal experience to bring serious change to the court, to bring new ideas, to bring bold new ideas, to bring a new generation of leadership into how we operate as a court and how our courts operate within our communities. And so I wanted to have this conversation tonight because one of the areas of probate court that is the least well understood and the least well explained is the mental health aspects of it. Also, during this COVID environment, we've known that it's also been a mental health problem. We've seen it manifest in different ways. We've seen it manifest in abuse towards women and children. We've seen it manifest in an increase in suicide rates. So our mental well-being is an important component of our physical well-being and vice versa. And in living in a society, it's really important for us to consider all of our people, even especially those who are suffering from mental health issues. So I brought in two friends of mine today. Two people I've known for a while. One I've known basically my entire life. And so I want to introduce you to them to give you an idea of what their background is. Because I think it's important not only to hear this, from the perspective of someone running for office, but to hear about these issues, how they appear in courts, and also how they appear to mental health professionals. I think that's an important aspect that we need to understand. But where I think it gets really important is that we have the opportunity here by having Priya on, is seeing how do other places do this. She is a physician outside of Boston, Massachusetts, and so we've got the opportunity to talk to somebody that not only can explain the medical side of what's going on, but can also talk to us a little bit about what are different approaches that she's seen to how this is done. And then also with Jenny, while she's based in Cincinnati, her practice takes her all around the region. And so they both provide us opportunities to learn better ways to do things from our surrounding communities. So I'll give you quick bios of the two of them, let you know what their background is, and then we'll have an introduction from them, and then we'll go into questions, and hopefully we'll all learn something tonight. So Jenny, Dr. Jenny O'Donnell is the CEO and Forensic Director of Forensic Evaluation Service Center, one of 10 accredited forensic centers in Ohio, and the center accredited for Butler, Warren, Preble, Clinton, Pike, and Highland counties. Dr. O'Donnell also has a private practice in counties that her agency does not serve, as well as serving as a consultant to other forensic centers around the state. As an Ohio forensic psychologist, she has been qualified as an expert in over many counties up to Franklin County, where she has conducted evaluations for criminal and probate courts. Dr. Priya Sehgal is a board-certified psychiatrist to provide psychotherapy and medication management to children, adolescents, and adults. She currently serves as the medical director of Riverside Community Care Children's Services in Cambridge, Massachusetts, as a staff psychiatrist for Tufts University Counseling and Mental Health Service, and as a part-time instructor at Harvard Medical School. She completed her general adult psychiatry residency at the Cambridge Health Alliance Harvard Medical School, where she served as a chief resident in cultural psychiatry and also completed a fellowship in child and adolescent psychiatry. So I'm really excited to have Jenny and Priya here. I think it's going to be a great conversation. But first, I'm just going to hand it off to them to plug in any gaps that I may have missed and introduce themselves. So we'll start with you, Jenny. Thank you again for being here. Tell us a little bit more about yourself.
Okay, Pavan. Well, first of all, thanks a lot for letting me join this conversation. You know how important this topic is to me. I think I've been talking about this to you for years. And Priya, I'm super excited to hear from you today too. And it's great that I've gotten to meet you. So my experience in criminal and probate courts has shown me the strengths and weaknesses of these systems. I've been doing this for about 20 years now. I've done a lot of work in Southern Ohio, but also in the criminal and in the probate system. And the folks that I see they range, they range from no mental illness at all to folks who are really, really severely have severe mental illness or intellectual disabilities and are really impaired because of it. We don't always have open doors for folks or good handoffs for folks to get services or to stay connected to services. And our probate and our criminal court systems operate in two chasms. They're almost two silos. And in many counties around Ohio, they don't speak to each other and they don't play nice with each other, frankly. The criminal court system has an opportunity when somebody has committed a crime to refer somebody to the hospital if they feel like they're not competent to stand trial, or maybe they're um, uh, not guilty by reason of insanity. And in some cases, the probate court can look at that and say, well, that's not our problem. Whereas the criminal court will say, well, really, we didn't want to send them all the way down that route. We'd rather just get them reconnected to services, but we don't, as criminal court system, we don't have any mechanism to do that. And so that's why you've seen these hybrid courts, right? The mental health system, mental health court, mental health dockets, specialty services. Probate court, on the other hand, has this mandate that they can only intervene with someone with severe mental illness and or intellectual disabilities and even addiction, severe addiction problems. They can only intervene if somebody is really so horribly decompensated or totally impaired to the place where their life is at imminent risk, or they're threatening to kill somebody else. And even then, they can only hold them for a few days at the most. They really can't enforce any real treatment connection. And I hope folks walk away tonight from hearing that I'm looking for activist judges. I'm looking for somebody who is going to advocate for people with severe mental illness and systems that really address those problems. I've been on these conference calls with a lot of candidates and elected officials over this whole year saying, what is your office going to do with the dearth of community mental health services in our communities that are, they're getting slashed left and right? And with this gulf, how are we going to join this gulf? So that's why I'm here tonight. I really appreciate it.
Thank you. Priya?
Yeah, thanks so much, Jenny. Well, first of all, thank you, Pavan, for your work and your candidacy. And then also, Jenny, just for your expertise. I'm really humbled to be joining you both. And as Jenny mentioned, mental health is often ignored. So the fact that we're even talking about this, and Pavan, you're bringing this up to in the light, so to speak, is I think a reflection of I think the kind of judge in terms of the values that you're really trying to uphold. So first, I'm a Cincinnati native. I grew up in Finneytown, Ohio, part of Hamilton County. I still have family there, but I'm a pediatric and adult psychiatrist. I trained in Massachusetts, and this is where I practice. As Jenny said, there's no doubt that we have a shortage of mental health services for folks across the lifespan. Not to mention the disparities that exist in terms of getting access to mental health care, but also coverage. There is not parity between medical and mental health. And then currently, we're really in the midst of two pandemics. The coronavirus, certainly, which is exacerbating many underlying mental health challenges. They're creating new mental health challenges, and certainly it's the downfall of that, or the downstream effect, is that it's really exacerbating other social determinants of health that really are not going to help folks who struggle with mental health problems. In addition, we're facing ongoing and enduring effects of racism. And really the need to address emotional health could not be greater than it is right now. As a psychiatrist, and I work with youth in the community mental health setting that are often plagued with issues of trauma, disrupted attachments, historical trauma. And even in college mental health, I see young people who have been impacted by unfortunately, historical aspects of trauma, adverse childhood experiences. But I tend to see at my front door, so the clinic or the office, is really these flashpoints. And I call them these flashpoints of intersecting systems of care, which includes medical system, mental health system, schools, families, obviously employment, and certainly the legal system. And unfortunately, the legal system is a de facto mental health system.
Yes.
And so, I think of people getting into the mental health system from various points, and certainly the legal system can be one. However, it needs to be one that is really going to focus on treatment, reform, and recovery, and not be a penal system. And I think that often in many communities, the other access point is through emergency services, where folks need to call 911 or call the crisis teams, but are afraid to, certainly in communities of color, immigrant communities, because they're afraid that they may not get routed to the medical care. And I'll say in Massachusetts, they really have invested in these wraparound services, and really trying to train EMS and first responders to have more of that mindset, but it's not perfect. No system is perfect. And I'm here because I think that, I think Pavan as a judge is someone who does understand these intersecting systems. And I think that we really need, as Jenny said, an activist judge, somebody who's going to be able to break the silos that most of the time people are in. And we know we can't move forward without having all these sectors work together. So I really hope that folks here and beyond can donate time to the campaign, or even a financial donation as well.
Thanks for that. I think you both touched on a couple things that can kind of kick us off. One of the questions that I get asked the most about, especially in relation to the mental health component of the court, is what interaction do you see the court and the police having, and what interaction do you think they should have? Now, my response to that is not enough currently, and the wrong type. And the answer as to what I would want is significantly more. And I think, Priya, you talked about it, just the intersectionality between the penal system and the mental health system. And so that's how so many of these people get picked up and brought into the system whole, but get routed to the wrong direction because their first interaction is with an emergency service provider, is with the police. And so my vision for what I want this to be is a system where we train police, we train other social workers, we train community advocates, people out in the community to understand what mental illness looks like and what treatment can and should look like, and get them all to understand that if you call the police and the police are well trained, then maybe we can route that person to get services instead of just tossing them in jail. Exactly. But that's got to be a holistic model of wraparound services that involves, the sheriff's office because they run the jail. It involves the probate court because somebody needs to come to the probate court instead of the general division in order to get this treatment. That involves the local police, who are potentially the people that are picking somebody up. That involves the firefighters and the EMS workers, who are going to be the people making these runs. So it's got to be holistic. And I don't think of it necessarily as an activist judge. I like to talk of it as a much more engaged judiciary, because I think that is broader, and it talks about how you can build a judicial system that isn't only focused on, I'm going to decide the case in front of me and I'm going to move on to the next one and then I'm going to be done.
Right. Absolutely.
How do you use the resources of the court to really engage with the community? How do you use the resources of the court to build services and to try to alleviate problems before they even come to the court? One of the great things about the jurisdiction of probate court is because it is so broad, there's a real opportunity here to do things differently and ensure that we are building a community that is looking towards providing services, providing assistance, and not just trying to criminalize everything and shove people into the general division through an arrest.
Okay, one of the things I hear most often, Pavan, to that, specifically about probate court, and this varies across Ohio because every there's 88 counties in Ohio. Every probate court is different. Every probate court is run by usually one sole judge, and it's the personality of that judge that sets the tone for how things are going to happen. And I work in Butler County that has this really incredible and actually pretty much groundbreaking model for something called outpatient community probate. And so people with severe mental illness who have a history of failing to stay connected to services and finding themselves in great physical and mental health danger because of that can get connected to services, and they have to come back to the probate court on a regular basis for quite a long time. I will tell you, they stay very connected for a very long time, but it allows them to still have a life outside of the hospital. And it allows them to have a quality of life and somebody who's checking in on them. Now, don't get me wrong, I'm a huge civil rights advocate. I want people to have the right to have all their freedoms, but when their freedom is such that it jeopardizes their life at every turn, are we really giving them freedom? I mean, what are we doing? And as a society, what do we want to do? These are some of our most needy people who are taking most resources out of a system that's already stretched really way too thin. And so what I'm looking for is a judge who wants to hear about what other entities are doing to help manage services, and maybe not just throw somebody in the hospital for 3 days and then say, oh, they're no longer imminently dangerous to kill themselves or others, so that's it, we're done with them, we don't have to see them again until the next time.
I mean, in Massachusetts, so the way it works is you don't have to get a commitment, or you don't have to go in front of a court or a judge to get that 3-day hold. However, once that timing is expired, then you have to petition a judge within a probate court system. Now, the system is designed, unfortunately, you can't progress up in terms of levels of care that's often clinically needed until you really start to fail. And I think the thresholds that a probate judge may have, I think, will vary, and is complicated because like in medicine, we're really trying to adhere to patient autonomy. There may be a different threshold of what is one civil liberty, and do they have the right to really make an autonomous decision? Do they have the capacity? But I think that through experience and perhaps more partnerships with mental health professionals, probate courts can learn from the experience of other clinicians that may be able to not have a fixed or rigid kind of threshold in making those decisions as to whether or not, either in Hamilton County, if A, somebody has to be admitted to the hospital, but maybe B, actually need to go up the ladder into more residential treatment programs. And granted, this is really the opposite of where we are in community mental health, which is we want folks to be able to thrive in the community. That's where the funding has gone. And there was an effort to deinstitutionalize folks that have serious mental illness. And so there's benefits to that, but the reality is community mental health systems are often even more underfunded. And so people can't necessarily have a quality of life where they have some meaningful employment, stable housing, adequate access to nutrition, which just furthers them cycling in and out of the systems. And then ultimately they will likely get to a place where they have to go to court to get to determine whether or not they can stay in the community or go elsewhere. So I think I think the role is about, understanding what functioning is. And maybe getting kind of a perspective about the threshold for when being we use paternalism in medicine as something that is a way in which we may make decisions for others. So I don't think it's a one size fits all approach, but I do think thinking about overall functioning and not just imminent suicidality or certainly imminent, risk of hurting or killing someone as a homicidal ideation. But really thinking about people's functioning in the community as a reason for possibly needing to take away civil liberty to be and to get treatment.
Well, I think you both brought up a lot of stuff that is on the list of things I wanted to cover tonight. So I'm glad that this is where we're starting from. Because one of them that we'll just skip ahead briefly right now is this idea that our laws are woefully inadequate to deal with this aspect of medicine and law and the intersection between the two. When most of our laws were written, especially in regards to mental health, we just did not know nearly as much as we know now. And so one of the ways this manifests itself is that gap between when someone is a threat and when someone is actually able to fend for themselves and be autonomous and live their own lives.
Right.
And I know from my background, having worked at the legislature for 4 years, that's one thing that we need more advocates on. We need more people to be able to come to the legislature, especially frontline workers in mental health, but also people from the court and say, this is what the law needs to be. Obviously, we do not want to take away someone's autonomy, their freedom, their civil rights, or civil liberties, unless it's absolutely necessary. But right now, it feels like we have an all or nothing scenario.
Yeah, that's it.
And we really need to be able to allow the laws and allow a court and a probate court judge to have the authority to deal with the shades of gray in between. What are your thoughts?
Absolutely. 100% I agree with you, Pavan, that is the issue here, is that we don't give our probate courts enough tools to function effectively for the folks who need them. And we don't give our folks enough tools to survive on their own in the community. As you said, it's so black and white, right? And for me, it's like, I think about chasms and gulfs, because what I see is somebody comes out of the hospital, with no money, no medications, a piece of paper that says, go connect to your community mental health agency next week if you can get an intake appointment. And, if your case manager is there and they can get you in on their book and yada, yada. And these folks tell me, and this is what they've told me for 20 years now, but I didn't know how to call my case manager. I didn't have transportation I couldn't figure out how to refill this prescription. So I talk about the difference between civil rights and this free fall into this chasm of nothingness where they have no supports at all. And I think probate courts really I think 1975 is when we last really overhauled the probate court system. My God, that was the middle of deinstitutionalization that Priya brought up. You were absolutely right. Right. And that came for a good reason. But it wasn't the end of the story. It was the beginning. And it feels like nobody's done anything about it since then.
I think now with the Affordable Care Act, and hopefully it stays around, medical systems are being compensated. There's an incentive for addressing social determinants of medical and mental illness. And so in my dream world, I don't know if that was one of the questions, but I think it would be great to have, again, I just think of the front door. For some, unfortunately, the legal system, or due to their mental health, they may be making maladaptive choices that contribute to transgressions. And so they start there. They start in that system. But if a probate court had almost more, almost like a triage, where you're even if it gets missed in the, kind of crisis moment or whatnot, but there's another layer of really assessing where you can do those mental health screenings to determine where they really need to go, but also what are some of the social determinants that contribute to their instability. And could there be a way to then connect that to existing community services? So even though they're not in a clinic or in a hospital, but that system, that mindset is happening. It's just kind of in reverse, which in some places, as Jenny, you were saying, there are places that may have more of that mindset,
Mhm.
but it may be dependent on the folks who are running it.
So you touched on it, the idea of like, okay, in a perfect world, what do you want this to look like? What, Jenny, what do you like if you could design this system from the bottom up right now, redesign the entire system, what do you think it will look like? You mentioned the idea of, outpatient clinics, and I think that's a good patch right now. But if you could start from scratch, how would you build this system?
So I don't know about scratch, but one of the things, and Priya, you hit on this, and I loved it. Think about if there was a liaison between the criminal court system and the probate court system, and so because most of my world is criminal court stuff, right? But I see the same people every year, maybe even every month sometimes. And so what I know is, I'll have seen somebody for the 16th time in the last 20 years, and I don't really even have to evaluate them. I just say to them, how are you doing, Fred? I know you're probably off your medicine. And he'll tell me about how, all these crazy things that are going on in his world, but he was homeless. His mom had died a couple years ago. Maybe he started using crack again, all these things that came into his world. So what if the criminal court could say, whoa, 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 we've seen Fred 16 times in the last, 12 or 14 months, because he'll be in all the different municipalities. He's just a little, he's a problem everywhere that he goes, bless his heart, right? And what if they said, to instead of saying we're going to put you in jail again, but if they said no, we're going to connect you to probate court, and probate court said, instead of saying, well, but he's not at imminent risk, right? And then we go down that. Probate court said, absolutely, this is your world. We are going to connect you to a more structured treatment, more supported treatment system with the power of the robe that is going to have checks and balances. And Fred, if you can stay connected to services, then we will back down on the supervision. What if probate court had that kind of mentality, that really this was about minimizing the interactions with police, and and those systems, those sources, and maximizing connection with real treatment options. And I think Priya's absolutely right. We have to treat the homelessness, the hunger, the lack of vocational skills, the indigency. I mean, all these things, the drug addiction, and the lack of support of family, because these folks who are doing nuisance crimes in the community have also run off most of their family and support. And so how do we get people reconnected to all the systems that keep all the rest of us healthier? I'm not saying we're all healthy. I'm saying it keeps us healthier to be connected to those systems.
I mean, we need investments in those wraparound programs. I mean, I'll just speak from the child standpoint. We have a child behavioral health initiative program. And what that does is it provides those wraparound services to high needs families. And then there's a child requiring assistance program through our probate court systems, that for kids who are, highly dysregulated, they are falling off their path and trajectory developmentally, they can get plugged into this kind of wraparound program where they have a probation officer, they have an outpatient treatment program. Often Department of Children and Families is involved, or the Department of Mental Health is involved in trying to think about how to best support the kid. And often there's a hot potato of who pays for what kind of services, but usually the judge of that probate court is the one who would approve of that, which then sets this in motion. Grants, there have to be a way to really fund something like that. But perhaps through various positions, you can structure those conversations that may help. But that's for the youth, much more. That's for like the youth demographic compared to adults, which is a whole nother ballgame.
But still, I mean, we know resources are a problem. And that, unfortunately, I think coming out of this recession is going to just exacerbate a lot of those problems, because there's just not going to be the tax revenue that the state has to help fund anything new above and beyond what already has been done. So to accomplish some of these reforms are going to take and going to need the dedication of a lot of different partner organizations. So who would you see, like what types of organizations, what organizations potentially in particular, Jenny, in the neighborhood or in the community, what organizations do you think are necessary to be partnered to make sure that all this, that we could build something that would really be taking care of people better?
Well, honestly, to have a probate court judge at the table, when when tax levies for mental health, the mental health board is considered. I mean, the thing that I think is most relevant to what we're talking about today is that the power of the robe, the power of the probate court robe, to be advocating. I don't mean yeah, you lend your name, when the levy comes around. I mean, you take my passion and you pound the table every single time you have these cases, or you get on the phone and as the probate court judge, you say, how did this happen? We have put all these things in place, or we want to put all these things in place. If you say that a few times, people are like, holy cow, Judge Parikh is on the warpath. We've got to make sure this doesn't happen again. I know Judge Rogers in Butler County has a reputation of being on the warpath sometimes, but he also has a reputation of getting things done. Judge Evelyn Stratton, former Supreme Court Justice, she is going around the state of Ohio screaming about outpatient probate commitment and eliminating unnecessary criminal court interactions when we should be diverting people into the probate, into the community mental health system. So when folks at that level, Pavan, when they say something, the folks who, the little psychologist in the corner who's like really super passionate about it, but no power, you amplify our voice. And I really think that that's what we need. We need champions like that on the bench. Now, do we need community mental health centers to step up? Oh yeah. Do we need the taxpayers to recognize that mental illness is one of the most expensive um, uh, illnesses to treat and keep under control? But we also need people to understand that preventative services are a lot less expensive than mitigation services or restoration services. So if we can dump some money in the front end, we
Right.
can actually, we can do so much more towards the back end.
We need our society to understand that for physical health as well, but that's
True.
a whole other conversation that does not involve this court, whatever.
But I think too, Jenny, you had mentioned in our other discussions about, we think of serious mental illness and people may just think of schizophrenia
Oh yeah.
or, an acute bipolar episode, but we don't also think about chronic mental health distress. So
Yeah.
PTSD, post-traumatic stress disorder,
Mhm.
obviously addictions, there's this, now I think
Depression.
there is more of a decision to look at addiction as an intersection of not just somebody's choice, but an actual disease versus often those, people are teasing apart, is this truly an addiction or is this a mental health issue? And if it's just addiction, then we can't in the mental health world take care of that, which we know addiction is so highly coexisting with so many other things. But my point is that, even if it's not kind of the SMI that many people think about, folks who have other illnesses do end up in the same system. And some of them also have coexisting serious mental illnesses. But I think that and really thinking about how does trauma impact and really overlay so many people's lives, and is an important element in thinking about the kinds of treatments that could be liaison with the court system.
Well,
So
I think that,
you know what I mean?
no, yeah, and I think that brings up a really a topic that I care a lot about, especially when you talk about addiction, when you talk about PTSD, and you talk about trauma. for the last 7 years, I've been a judge advocate in the Army Reserve, and for a period of that time, I was representing victims of military sexual assault as a special victims counsel. And so we know that these particular diseases affect that population much more acutely because we put them in harm's way. For example, we expose them. That is part of the deal, is that we expose them to trauma on a regular basis, potentially, especially people that have been deployed. And so one of the ways that the courts have been trying to deal with this has been the development of certain specialty courts. You have veterans courts, you have mental health courts, and then you have the probate court, but they don't all seem to work together.
Yeah.
They seem to be 3 separate systems. Okay, if you served in uniform, we're pushing you to the veterans court. If you if your primary issue is we caught you with drugs, we're going to push you to drug court. If your primary issue is something that's mental health related, we're going to push you to mental health court. Oh, and then by the way, potentially if you're at risk of giving yourself harm, we're going to put you to probate court. So you have these 4 separate systems out there.
Mm-hmm.
How do you see them interacting with each other? How should they be interacting better with each other? And what can we do to ensure that we're not missing anybody? Because what I see when I see 4 separate systems like that is the potential for 4 or 5 different gaps that people can easily fall into.
Yeah. Well, I think what's in common for all of them, and certainly from a psychiatric lens, is that trauma is something that impacts so many more people, regardless if you've served, if you've had the honor of serving. I think trauma is one of the most pervasive aspects to everyone's existence. So they should all be well versed in trauma-based assessments and thinking about what kinds of resources could folks be connected to address that. I'm thinking this from a more clinical standpoint than maybe obviously a legal perspective. But that's obviously the lens I'm looking through is how do you help people address the underlying causes or contributing factors to what they're presenting with. So I bet you, and on those courts, if you just assessed, if you did a trauma screening, they'd probably in all 4 of those courts score extremely high.
Yeah, and I think, Priya, you're absolutely right. I mean, I've done, I can't even tell you how many times I've done this research on my basic criminal population and the incidence of traumatic events. There's a couple of scales that we use. We used in a couple of the research projects that I've done where we just stopped using them because 90% of the folks and women who come through the criminal justice system, trauma is just a given. It's not, we don't even assess really for it anymore. We know the trauma's there, right? And so we can find it and sometimes for folks just being in the criminal justice system is traumatic, like everything that comes with it. So we've got that piece. I liked what you said, Pavan, about how do we, if we put people in these silos, right? Veterans, the reentry court, the mental health docket. How do we then, what about the people who don't fit in any of those categories? And what about the folks that don't fit, maybe you have the veteran in veteran court and it's not working for her, or him. What do we do with him or her now? I know I did some internship work in the VA system. I know what an incredible system that is, but not every veteran wants to go in it. And so if they don't go in it, what do we do with them? Where do we offer them services? And I think, I mean, Priya, you said this early on, this holistic notion that mental health care has to have parity with medical care and it has to be accessible to all. And we just as a society we have to stop battling against offering preventative and supportive services to folks. And oh my gosh, the chronicity of depression. we can talk about schizophrenia and bipolar and how expensive and how damaging that is. But the chronicity of depression, most of the folks I see for probate court are experiencing dementia, and they're experiencing dementia because they had chronic untreated depression for the last 20 or 30 years of their lives that really is taking a toll on their brain's ability to adapt to old age. And so when we think about the complexity of this, and yet as a nation we don't offer the preventative and the parity that mental health services really need. We don't even teach mental health hygiene in schools, or we don't advocate for a well-rounded holistic mental health checkup. What if everybody went to a counselor twice a year? You go to a dentist twice a year. What if you went to a counselor twice a year? I mean, I know that sounds crazy, but what if you did, and you got to talk to somebody for 40 minutes and just like, hey, this feels really great. Maybe I'd like to do this again. I mean, I think we could really nip some of this early stuff in the bud. Now, we've also got on the other end of the continuum those folks, right, who they keep going off their medication, they're using drugs and alcohol as maybe self-help, maybe it's maladaptive personality, but at the end of the day, they're still creating really serious problems for themselves and for society around them. And I think this gives a probate judge and the criminal court judges, Pavan, you're not the only judge candidate I pick on, but I think this gives all of them a real opportunity to say, our criminal justice and probate systems are broken, and we are treating mental illness with criminal and legal responses instead of, I mean, we've got Dr. Priya Sehgal here, right? I mean, instead of with real science, real medicine, real therapy.
Well, and I think that, if you want to talk about one of the other issues just on the legal side of this too, is access to counsel. Because there just isn't enough in general. You take a look at the general population, there's not enough access to counsel. You then look at an indigent population, there's even less access to counsel. Then you add in mental health care issues. We don't have enough lawyers that do this type of work to really effectively train other lawyers, to train judges, to train other people that they're interacting with in the legal system as to what they need to be doing. So one of the things that I've proposed and that I look forward to working on if I ended up winning this election is working with the law schools. I mean, we need to spark an interest in this area of law for a lot of people. And the University of Cincinnati College of Law, for example, has a law and psychiatry program. It's a dual degree program. It's an amazing program. But we don't have a clinic set up to the probate court. And that to me just seems like something simple that we can do to ensure that we are getting this population access to counsel. We're getting law students interested and engaged. We're getting PsyD, PhD, MD students interested and engaged. And then we've created a pool of people that can speak the same language, that understand the policy implications, that understand the legal implications, that understand the medical implications of everything that they're doing.
Absolutely.
And so for me, that is one of the things that's a priority. That, okay, this seems to me like a simple solution. It doesn't get us all the way to where we need to be, but it is a significant step forward of at least recognizing we have some resources. Let's marry the resources with the courts.
Absolutely. I think, Pavan, that's a fantastic idea. Also you're tapping into people who are eager. You're imprinting in their brains, and they'll get a visceral understanding of some of these cases. I mean, in my training, we do a forensic rotation, and I sat on cases in family probate courts for kids. And I tell you, those experiences and writing those long, long reports for the judges has stayed with me, and it's really governed a way to help me understand a little more of the legalities that I would never know. So in reverse, folks in the legal world to be able to work with amazing psychologists like Dr. O'Donnell various other colleagues, it will give them an awareness that I think could be helpful. I think that makes a lot of sense. I hope that happens.
Yeah, me too. I mean, I'm part of the Weaver Institute, and oh my gosh, I would love to see that happen. There's a third leg to the stool too, and that's the individual and the individual's families. And I've heard countless stories about folks going to probate court and never getting to speak on their own behalf, never being listened, their families not being heard, their families not being welcome, their families not being notified. There's HIPAA, and there's a lot of things around confidentiality and stuff like that. But there's some ways around that too. And what if we had somebody advocating for, when you are someone who is known to have severe mental illness and known to decompensate, that when you're actually at your baseline or doing well, somebody sits down with you and talks to you about your legal rights and writes up some kind of a document, almost like a living will for folks with severe mental illness, that says, hey, I'm in my right mind right now, and I want you to know that I really want somebody to advocate for me to get back on my medication the next time I decompensate. I don't plan on decompensating, but by the time I've decompensated, you can't talk any sense into me.
Right.
I want somebody to have. So what if there was something like that? And I don't know, maybe there is, but I haven't seen it. The other thing is this notion that when people go to probate court, actually when anybody goes to any court, if you're not a lawyer, if you've sat in on room A or any of the misdemeanor courts, it is mumbo jumbo at high speed, and if you are not really well attuned to it, there's no way you know what just happened. And probate court shouldn't be like that. I mean, probate court should involve the person who's being, I don't know if it's accused, but alleged incompetent. I don't know the exact words there, but probate court should involve them. And okay, if they have really decompensated and it's really embarrassing or not good for them to speak, I get it. But still, there has to be a modicum of respect for the person and for the family, and a way for the family to give input and be heard and considered, and at least address their concerns, just so. That's another thing I really think is important. Organizations like NAMI are really, really valuable when it comes to this kind of stuff.
Absolutely.
Well, I think that what you speak to there, though, Jenny, really goes to the heart of one of the issues in all of this, is just a lack of training for the people making these decisions, for the people in charge. And maybe it's a continuing legal education requirement that every 2 years that you have to get your certain number of CLE hours, some portion of it's on mental health, whether it's inward on you or dealing with clients.
Yep.
Trying to understand a little bit more about what actually happens. Because, for example, in the legal profession, we know the legal profession has one of the highest incidences of depression, one of the highest incidences of substance abuse. We know these are diseases that lawyers are a susceptible population to. So it would behoove the entire industry to understand these issues a little bit more intimately, because you never know when it's impacting you. It could be impacting a partner of yours, one of your associates, just anybody else in your life. And so I guess with the idea of training, I mean, what additional training would you like to see that lawyers or judges are going through, or exposure that they need to have? What additional training do you think that people need to have on just the basics, the idea that someone with serious mental illness, how they formulate thoughts, how they can formulate thoughts, the idea that, hey, there is a period of time where somebody may be lucid and does have the mental capacity to put their wishes down into a mental health living will. They're not just always going to be having issues.
Right.
What are other general concepts around mental illness that you think are really important for judges and people in the courts to understand, because you've seen them get it wrong so often.
Well, so I think there's a, oh my gosh, the list is really
Really?
blowing up in my head right now. But one of the first things is this notion that you just hit on, is that folks who have severe mental illness, they are not always um
The way you see them.
yeah, they're not always unable to express in a logical and rational fashion. And in fact, it's kind of rare that they're that bad, right? That they've decompensated that badly. It's more likely they're having a bad day, they're having a bad month or week, and if somebody would just help them get their feet, briefly, they could actually get back on their feet and be just fine. So, like, early intervention, I know I keep beating this drum, but early intervention would be very powerful. And when somebody is in the criminal justice system, that's a big sign, right? That's a sign that something has gone really badly wrong. And often, if it's a minor offense, the courts will just, like, just give them 20 hours of community service
Yeah.
and be done and get them off the docket. I think the courts need to think a little bit more about this. One and done maybe, but 3 times of doing this, what are we doing wrong here? The other piece of it is that, I mean, I'm not saying, don't ever think I said that people with severe mental illness should not be responsible, because often they are very, very well aware of the wrongfulness of their actions. No doubt about that. But they sometimes can't refrain. And, when we talk about the criminal system, the laws in Ohio changed back in the 80s, along with several other states, from inability to refrain from these actions. So the voices tell them 100 times to kill your mother, kill your mother, kill your mother. And 99 times they say, I don't want to do that. I love my mother. I need my mother. I'm not going to do that. But the 100th time, they kill their mother. And then the court says, "Oh, well, did they know right from wrong? Did they, the court," and the mental health system says, "Well, that's not really what this is about. He was hearing voices so vehemently in his head that, yeah, he did know right from wrong, but my God, he didn't want to kill his mother. He just couldn't refrain." In Ohio, no, you're going to prison for that.
Mhm.
Now in some
Right.
states, there's the law says, well, if you can't refrain, then you're not going to prison. We're going to do something differently. But in Ohio, the law is really clear, and that's the most stringent setting for the law, and that's the law of the country as well. And in most states, I I'm not a person who says people shouldn't go to prison, but I'm a person who says, if the legal system doesn't understand the mental health system, how can you make a law that says what should happen to someone when they're under the clear effects of this severe mental illness? So legislators, lawyers, judges, they all really need, you're absolutely right, they need personal experience with counseling. They need to see the therapeutic effects of it. They also need to see the detrimental effects of not getting treatment when treatment is warranted. And then, and this is one of my worst things, but when somebody says to me, "Oh, I would have ruled differently before, but now a member of my family has this mental illness and I understand it so much better, and so I'm going to rule this way," I want to pull my hair out.
Yeah.
I mean, because if it's just because your family is experiencing it now, and so now you change your mind, what the hell? I mean, I really think that the education has to be systemic.
Absolutely. I mean, I think Jenny, you painted such a vivid and picture, and I can hear your passion, the people, your patients, and the folks you work with. They're so lucky.
Ugh.
I would say in terms of training, you know, one, I think law students should, the University of Cincinnati Law School should have, and maybe they do, some program with the medical school. and rotate on the inpatient psychiatric units and talk to the psychiatrists, and rotate, shadow them like medical students. But to understand this terminology of baseline, who knows, like Jenny, your point of what is the baseline? How off are they?
Yeah.
In terms of the acts that they committed or allegedly did during this time that got them to the court, what kind of treatment were they supposed to be in? So I think understanding where do they normally live, and how are they different? To what extent have they decompensated, and why? Is, I think, always important to understand, at least to get that context of their overall mental health and their well-being. I'm not a lawyer. I can't really go beyond that, but I think just getting to know what their general functioning is. But I also think just having that understanding of what a psychiatrist does, especially in inpatient units, where that law student is going to see the process of where maybe, yes, in a probate court, they got the ruling to admit somebody, and then what happens, and what are some of the services that patients might actually get connected to. Because when you're probably standing and talking or sitting in a courtroom with some of our patients, without some of those quick questions, it could be very confusing to know where to start. I think also having law students go to NAMI. When I was in medical school, I went to the NAMI Family and Friends, and it was one of the most moving experiences to just hear, first of all, what a spectrum of schizophrenia actually is, and the kinds of distress that the families are under, but also how they actually get into care, because that does humanize the process. But again, like Jenny, you're saying, and Pavan, you had mentioned too, we're not absolving people of their actions either, and people have to be held responsible as well. But understanding the context, I think, is equally important.
Well, and that training needs to go, it needs to be system-wide. It needs to start in law schools. It needs to be mandatory for prosecutors. It needs to be people that interact with this population significantly. And quite frankly, 98% of the time have the authority to decide what happens next. And so that's something that needs to be important. But that also brings up, we're running a little low on time. We got started a few minutes late because I was having some technical difficulties, but I haven't seen any questions in the chat. So the one thing that I know that we all wanted to talk about that I want to bring up now is looking at some of the effects on certain segments of our society. So we know that mental illness and severe mental illness is a problem across society. We also know that communities of color experience this worse. Whether it's a higher incidence rate, whether it's a lower treatment rate, whether it's an overcriminalization of conduct, the systems are not set up to be forgiving when you're dealing with someone that comes from, especially the African American community, but other communities of color, and especially poor communities of color. So thinking about that, how do you get a young or old African American woman who's going through this process? How do you get her? How do you get her family? How do you get her friends? How do you get her attorneys? How do you get that whole community to trust this process, to really access emergency services, to try to go early to access these services? Because Jenny, you've been really, really pushing the idea that we need to get early intervention. How do you do that when you've got a population that you call the cops, you don't really know what's going to happen?
Right.
Yeah, I mean, we talk a lot about this actually with the children we serve, and it's a slow process because you need trust, and trust has to get earned, and that can take time. So I think the long-term game plan would be about how can you utilize the power of the court to get to know communities, get connected to faith communities, try have to from the grassroots basically have conversations about mental health, because there's so much stigma about mental illness across every community, but particularly in minority communities as well. So that would be, I think, the kind of philosophical, more longer term approach, but also being able to have conversations about what your legal rights are. So if you have a child who has autism and you're calling because they're dysregulated in your household, what can you do if somebody comes to your door and does not make you feel safe? What is in your right to be able to say yes or no to? And so having more of those educational forums, I think, is really important. I think going back to how do we diversify? Who are the lawyers and who are, judges, but thinking about who are people seeing and do they represent who is a part of their community in these positions of power? And so, I'm a child of immigrants. Pavan, to see that you're running, I think is a very groundbreaking and important part that you're going to be a part of hopefully for this community.
And for me, I think, Priya, you hit it really hard that we need more people of color in the prosecutor's office. We need more people of color on the bench and in our treatment facilities. And as lawyers, I mean, really, and it's not just people of color, right? It's people of immigrants status. It's people who maybe have had experience with PTSD or chronic depression and understand firsthand how these things happen, or from the LGBTQ community. We need that representation in all of our professions, not not just one or the other. The other thing that we need to do, and this is something that Priya triggered in me earlier, was we need to teach our lawyers on both sides of the bench, or both sides of the table, and also on the bench, obviously, how to speak to defendants. I mean, oftentimes we've put, and I sort of alluded to when I talked about room A, the frenetic pace of room A means that when a public defender, because that's usually what we're talking about, goes to see his or her client, who's probably been locked up now for 24 hours or just under 24 hours, that the lawyer shows up, the defendant is behind bars, and the lawyer says, I'm your lawyer. Listen, you're going to be 6th on the docket, and it looks like your charges are criminal trespassing, and just tell me what you did, and do you want to plead out, or do you have somebody here for you, or do you have a phone number? Oh my gosh, people with severe mental illness have no idea what's going on. The person on the other side, the one person who is assigned to advocate for them, is not going to be trusted, right? You didn't engage them. You didn't listen to them. You might not even ask them their name. And so I think one of the things we need to do is we need to teach basic motivational interviewing techniques to lawyers. It's not hard. I mean, Pavan, you know how easily I engage with people. Like that comes naturally to me. You guys can see that, right? My first word was hi. So, but it's not hard to teach, right, to professionals of how to engage someone and listen for 3 seconds before you barrage them with questions. And that's a big open first door to building trust. Now, maybe they won't look like the person on the other side of the bars, but if they can at least think that they're heard, they will at least feel heard, and then maybe the trust door will open. So that's a first step.
And I think that's one of the most important things, is that for anybody involved in this system, that we make sure that everyone involved and everyone engaged feels like they're getting a fair shake, feels like they're being heard, feels like there is empathy in the room, regardless of necessarily who it's coming from, but that there is an openness to engage with each individual and what their circumstances are. And I think it is incredibly powerful if someone is coming before a court and can feel that coming from the bench. I think I've seen enough instances where you see people that have been rehabilitated that may have come in with a drug problem and have been rehabilitated. And one of the first things that they say is that, the judge looked me in the eye and they addressed me by my name. And then, in a transgender community, they addressed me by my proper pronoun. I mean, little things like that just matter so much to an individual. And whenever people sometimes ask, well, why do you think it matters so much? Like, well, imagine if somebody got it wrong to you.
Yeah.
I have a name that people don't particularly understand. So when I get mail that is addressed to Ms. or Mrs., I'm like, well,
Yeah.
Yeah, and I
could have
think
just Googled it, figured it out. But again, just thank you both so much for taking some time tonight. We've been doing this for about an hour. I really do appreciate it. We've talked a couple times just trying to get the ideas of what we wanted to talk about. There's so much more to talk about. We could do this for at least another hour, if not build an entire course around this.
Let's do that.
And not the least of it is something that we talked about at the end, is just the effects of mental health, mental illness on communities of color, the effects of systemic racism and how it has perpetuated problems over years, decades, centuries, and how we need to engage in order to actually alleviate these problems. And that's why I'm running. I think it's important to have a judiciary that is engaged with community partners, that is engaged with the medical community when in regards to the mental health docket, that is engaged with all sorts of social organizations to make sure that everyone is felt, everyone is heard, everyone feels like they're being heard, and everyone feels like they've gotten a fair shake at the end of the day. So with that, I'll leave. If you, Jenny and Priya, have any just closing comments, the floor is yours. But again, just thank you everybody who came out tonight. I know that we had a few technical difficulties, so we didn't get this up streaming live, but we're going to post this, so hopefully people can take a look and learn something. I know I learned something, and I really do appreciate you both taking the time.
Pavan, I just want to tell everybody, I really hope they come out and support you with a yard sign or a vote. Obviously a vote, right? That's huge. Or a contribution. But let me just tell you from the very bottom of my heart how much I appreciate that you had this conversation.
Thank you.
Yeah, thank you, Pavan, for having the interest, and clearly you're committed, you're interested in this very important topic. I too hope that folks out there support you. Definitely go out and vote, and we think also have time or can donate as well to your campaign. But thank you so much on behalf of so many individuals who don't often get a chance to be able to talk about these very important issues. So
thank you all so much. And like Priya said, vote, vote, vote. The polls are open during the days. We're at the last 2 weeks now. The polls are open on the weekend. So go down to the Board of Elections and cast your vote. If you've requested an absentee ballot, you can fill it out, you can mail it back in, or even better, you can drive it down to the Board of Elections and drop it off yourself so you know that it gets there. And if you haven't done either of those things, November 3rd is 2 weeks away. So vote on Election Day at your local precinct. Thank you all so much for joining us tonight. And I look forward to talking to you all very, very soon and trying to bring some much needed reforms to our Hamilton County Probate Court. Thank you all. Have a great night.
thank
Good
you.
night.